Can hysteroscopy remove uterine polyps or fibroids that affect fertility? Have you ever wondered if a hysteroscopy can help with fertility issues related to uterine polyps or fibroids? Hysteroscopy is a minimally invasive procedure that allows doctors to look inside the uterus with a thin, lighted tube known as a hysteroscope. This procedure is commonly used to both diagnose and treat conditions that affect the uterine cavity, including uterine polyps and specific types of fibroids that can impact fertility. Uterine polyps are growths that attach to the inner wall of the uterus. They can interfere with the implantation of embryos and may cause irregular bleeding. Hysteroscopy allows doctors to see these polyps directly and remove them with precision. By doing so, it often improves fertility outcomes by restoring a more normal uterine environment. When it comes to fibroids, hysteroscopy is particularly effective for submucosal fibroids. These are fibroids that grow just beneath the lining of the uterus and protrude into the uterine cavity. They can distort the shape of the uterus and impair fertility. With hysteroscopic resection, these fibroids can be removed without needing more invasive surgery. However, fibroids that are deeper within the uterine muscle or on the outer surface, usually requiring different surgical methods, such as laparoscopy. There are several benefits to using hysteroscopy for the removal of polyps and submucosal fibroids. It is a minimally invasive procedure, often performed without general anesthesia, which means a quicker recovery time. It also allows for the direct treatment of uterine abnormalities that may cause infertility or recurrent pregnancy loss. Additionally, during the same procedure, doctors can diagnose other hidden uterine issues that might affect fertility. It is important to understand that, while hysteroscopy can improve fertility by removing these intrauterine abnormalities, the success of the procedure depends on individual factors. These factors include the size and number of polyps or fibroids, the overall health of the uterus, and the presence of other fertility issues, such as endometriosis. From the perspective of fertility and endometriosis, hysteroscopy is a valuable tool. It addresses uterine factors that may complicate fertility challenges. Endometriosis can cause inflammation and scarring that affect fertility, and having polyps or fibroids can further reduce the chances of conception. By removing these growths through hysteroscopy, the uterine environment can be optimized for implantation. In conclusion, hysteroscopy is an established and effective method for removing uterine polyps and submucosal fibroids that affect fertility. It plays a key role in fertility evaluation and treatment, often improving pregnancy rates when these uterine abnormalities are present. However, it is crucial to seek personalized medical advice from a fertility specialist or gynecologist to determine the best approach based on each patient's unique condition.